sip some tea while we spilling the tea. Yeah. Real talk, real smiles, dentistry. Safe space vibes, clarity. Pull up a chair, yeah, your family.
Well, we are back again, and it's actually the season finale.
It is the season finale.
This just
Finale.
as quick. Just as quick.
Right, I know.
A blink. A blink.
Yes.
I told you that the world is spinning faster on its axis. That's why things are moving so quickly now.
Yes.
Much more quickly.
Much more quickly.
But I thought that we should get together today to talk about something that goes on, and I would have to say, probably in 99.9% practices.
Oh, what is that?
I'm pretty sure, honestly. I mean, I don't have factual proof.
Okay.
But this is just because you hear it so much because it is a huge topic of discussion.
Okay.
And it does require adult supervision.
Okay.
Adult supervision is required.
Okay.
And what I'm talking about is the neglect that is often supervised in the practice.
Say that. Supervised neglect.
Supervised neglect.
So that is funny you should bring that up.
Oh, why?
Because
why that is?
in our team meeting on Wednesday,
Okay.
we talked about that very subject.
What brought it on?
A patient who...
Let me guess. Because this happens in a lot of practices. Does it have anything to do with x-ray?
Yes.
Go, continue.
Yes. So the patient had come in 2 times before, and he refused to have any images taken.
Afraid of cancer.
I don't know what the problem was.
That's the excuse a lot of the times. But you'll stand in front of a microwave. You'll keep your cell phone up to your head. We're surrounded by
Radiation all day.
all day long, even when you step outside.
Right. So, and we have a brochure in our office that tells you the amount of radiation from each certain things, like 2 hours on an airplane, standing in front of the microwave, all these things, and then at the bottom it's the image.
But you know what it is?
What?
A lot of times, I think it has to do with the cost. They're afraid of incurring extra costs because that x-ray might show that they know that that little tooth number 2 has been bothering them, but it's not really anything too bad. But if I mention it and they take an x-ray, then it's going to tell me that I believe I may have a crown that needs to be done, and it's going to need to be done, and I know it's going to be a lot of money, and that's fine.
Right.
Just say that. Just we don't have to go through this whole song and dance because, you get x-rays done when you go to your medical doctor. And,
Right.
and like you said, we're surrounded by radiation all day long. Sorry, continue.
Okay. So in the team meeting, we had a patient who was coming in, and he was due for images. Now, he was a patient who comes once a year to have his routine hygiene.
Oh, so he should be getting x-rays every single year then.
His routine hygiene visit. Now, I work for a dentist who actually prescribes images based on...
Oh, wait a minute. What did you say?
Prescribes images?
Why prescribe? It's the wordage. I love it.
Oh, I was like, because that's what he does. In order for someone else to do, like the hygienist or the assistant can't diagnose or give an
How is it
interval.
presented in your office? I'm curious.
What do you mean?
Because I have heard of many doctors in my clinical days say, I want to take.
Oh, I want to. No. So, and I'll get into that.
Okay.
So the doctors that I work with prescribe images based off, for the most part, based off of the need of the patient, because in our practice, he's been there for 30 years. So he's seen these patients a lot of them over the span of 15, 20, 25 years, right? Mm-hmm. And so he knows like the caries risk and so on and so forth. So it's not done according to how many times a year your dental benefits pays for it. He does it according to
the need.
So with this patient happened to have a moderate caries risk. And so the first time he came in, he was like, oh, I don't want to get them this time. I just don't want to get them. And he's a, he's a PETA.
Oh, wait a minute. Is he also a Kevin?
Kind of.
Okay.
And so they were saying, okay, but the next time you have to get them. And the reason you have to get them is last year or the year before, whatever. Last year you had this tooth number 1, 2, 3, 4 with that had caries interproximal in between the teeth.
And it's going to grow.
Right. And so we were able to catch those early so they didn't become larger. So the following year he came in and he refused them again. But this time he made his appointment and he was trying to refuse them
Again.
So here is what our protocol is. The doctors both said, now he has a moderate caries risk, and we were doing them once a year. There are some patients who have a high caries risk, and we do them twice a year, irrespective of what their dental benefits pay for or don't pay for. And the reason is explained to the patient. We have a whole little caries assessment, and the patient actually checks
Fills
yes
it.
or no to some things,
Okay.
and then they reveal what their risk is based on what they've checked, and they've done it. So it's not like something we're doing to you or trying to, make you believe you've checked off that yes, you drink soda all day. You checked all these things off. So he had a moderate caries risk, and so this time he was trying to refuse them again. And so our protocol is the hygienist is to stop, get the doctor. Don't try to explain or convince, go get the doctor. Because what happens is if I'm sitting at the front, I will say, we've got you checked in today, and it's not out loud. Today you're scheduled to have cavity detection x-rays. Naya is going to go ahead and take care of that first. Then she will proceed to do your hygiene visit, complete your hygiene visit, and then Dr. Handelman will come in and examine the images as well as your mouth. And he said, okay. Then he goes into the treatment room and he tells the hygienist, I'm not getting that done. And the protocol is, okay, absolutely no problem. I will be right back. So you're supposed to go get whoever the patient's provider is. So you go get the doctor, and here's the conversation with the patient. Here is the assessment we did for you for caries. You are at moderate risk based on your answers here. So based on your answers, we told you that you would need to have images once a year. And here's why. The last time we took images, we found 4 areas of decay in your mouth that had to be taken care of. So we filled those areas. So now we want to make sure to be able to prevent you from having larger problems. We take them once a year. And he said, I know, but I don't want them this time. And the doctor said, that's completely fine. But the protocol in this office is we don't operate in supervised neglect. Since if you do not want to get the images this time, it's completely your choice. However, I will let you know that I will no longer be able to see you. And this comes from the doctor. So there can't be any back and forth. We don't involve the team. This comes from the practitioner. And so the patient said, what? And he said, I am not willing to put my license on the line for your uncomfortability. We have noted here that you have a moderate caries risk. If anything were to happen in the future, that's my license on the line. So again, it's up to you. I'm not forcing you to do anything. It's your choice.
Because not getting them done, it could lead to it's like patient-led treatment risks because.
Right. The patient didn't go, what dental school did you go to? Because that's what I want to say. What dental school did you graduate from?
Oh, girl, I have patients all the time saying, yes, I'm a new patient and I like to schedule for a cavity. And I would say, oh, okay. Well, first let me get your name so I know who I'm speaking to. And so I'll get their name. And then so I'll say, so which tooth is this that you are saying that you need to have a cavity? Is this something that was treatment planned from a different doctor? No, I just feel that I have a cavity. Or I've had a patient, I feel I need a crown. after, I triage them on the phone.
Uh-huh.
And I would just say, well, let's first start off with doing an exam and an x-ray
Mm-hmm.
to see exactly what's going on
Right.
with the area. But x-rays have to be taken. And the unfortunate thing is that if you allow the patient to kind of dictate the visit
Mm-hmm.
and you okay it, you're kind of operating in an ethical gray area, I believe, in my opinion.
Girl, that ain't gray. It's black and white when it comes to that. You either get these dang images or you don't. Period.
Because,
But there are officers who are willing
yeah,
to pull out this piece of paper that says, I have been diagnosed and I have been told that these are necessary, and I'm signing saying
like
that
a
I
waiver,
acknowledge it.
a waiver.
Yeah, but what should be pulled out next is the court cases where the judge has said, I don't want, basically, that piece of paper doesn't mean anything. That patient isn't the expert you are.
Yeah.
So when that patient is suing you because now he needs bone grafting,
because that paper will not
it's nothing.
hold up.
It doesn't.
And
mean
I know
anything.
I know this to be true. Remember the office I told you I worked at where the assistant would be in the massage chair doing
And
the work
napping.
day.
Yes.
So we had this patient. We ended up getting audited.
Mm.
We had a patient who I can't remember what it was that he needed.
Mm.
It might have been, oh, I think the doctor suggested a pulp cap. I think that's what it was.
Mm.
And he didn't want to do it. And so he had him sign this waiver, right? And of course, he ends up, because it was such a deep cavity, he ended up needing a root canal, a crown. I think he ended up going somewhere else to have it extracted and implanted.
Mm.
And then turned around and then sued the doctor.
And this is the same patient who said, "No, I don't want that."
Signed the waiver and everything. Signed the waiver and everything.
How
And
about that?
coupled with it was something also he had him sign. It was that situation that got the ball rolling, but it was a time before that they circled back into the court case for the tooth that needed the pulp cap or
Mhm.
what have you. It had something to do with he was getting veneers.
Mhm.
And I forgot why he had him sign it. I can't remember. Because it's been so much time has
Mhm.
passed at this point. But he signed it. But of course, when he went to his lawyer and proposed to get this whole ball rolling, both of those things were, I believe, mentioned in that. Girl, they came and they gave you a very small time window
Mhm.
of getting all your charts together. And I had told him this before. I asked you to come in and consult with the office to make sure that everything was up to code with things that we needed to have done because there was no security on the charts.
Yeah, I
People
remember
were
that.
people would come in and clean the room, or, I mean, clean the office, and they could just go through the charts. They
Yeah.
were not locked up or nothing. It was all willy nilly. But yeah, that the whole thing with
Waiver.
the waiver, it's a documentation failure, and if you don't, and then the things that these doctors have got to, I mean, it's okay to trust your assistants because they're supposed to do your
Mhm.
charting. Because when I went to school for medical assisting, that's what we learned day one on how to
Mhm.
properly document.
Right.
You properly triage and
Right.
you document thoroughly. And a lot of, I mean, in our PMS systems, they allow us to put templates in and you just add to and
Right.
say, well,
Specifics.
right. But some people get a little too comfortable, assistants, and maybe because they're busy with the patient load for the day and not a lot of time to do everything, and those things kind of fall to the wayside. So it lies last on the doctor.
That's
So
true.
the doctor has got to make sure that there are no documentation failures because it'll be your license. Your assistant's gonna cry, oopsie, but you're the professional.
Oopsie.
You're supposed to look over your notes and not a glancery note either. You need to make sure that
Right.
it is what it's supposed to be. And if you don't, then you have to make sure that you close that accountability gap because at the end of the day, like I said, it is on you.
Yeah, the practitioner, the owner of the business. I just find it very interesting in when we're talking about supervised neglect, it's not only with images. You have it when you have patients who have active infection, and we're talking periodontal disease.
Oh, girl, that's the next. I'm glad you brought that
Yeah,
up.
and
I just want a cleaning.
yes, I just want a cleaning. My insurance covers 100% because if you're in network, my insurance covers 100% of cleaning. So that's the cleaning I want.
Can I tell you a story real quick?
Yes, please do.
I think this was the first day. I think you might have been there that day. This is when we were at that group practice.
Oh,
When I was first moved to the back. I think it was the first time that we were on the floor together during the work week. Because we usually see each other on Saturday. So I think this was the first day that I was actually on the floor during the week instead of the weekend. And it was this patient, very nice Latina lady. She called, said that the only thing that she wanted was a cleaning. So she comes and do her paperwork. She made an appointment. So of course, since I'm the assistant, I go up to get her because I was assisting the doctor. What did you call her? The doctor that performed hygiene. You gave it a title. I forget because it is a title.
Yes, it is.
What is it called again?
It's called
Okay. A dental therapist. So, and it's an inside joke, which is why we're laughing. So
Yes.
you don't don't think we're coming for the profession.
No,
we're
not at all.
No, it's an inside joke between us and this particular professional.
Yes.
And she's well aware of it.
Yes.
But anywho, so it was my first day on the floor working with her. And so I go in to document, like, so, hello, how are you? My name is Gina. I'm going to be assisting Dr. blah, blah, blah. So what brings you in for today? So, she was like, oh, I just want a cleaning. I haven't had a cleaning in 10 years. Now, mind you, and I'm not I'm not dentally shaming anyone. And I was 20, 21, I think at this point. Because this is very early on in my dental career. And even though I was not very well versed clinically at this point, because remember, I'm very at the beginning of my dental journey as an assistant, clinical wise. And when I tried to take her x-rays, I could not because there was so much clunks everywhere, you know what I'm saying?
Tartar?
Calculus, tartar. It was a lot. At first I thought, and I'm not saying it to be, I'm not trying to say this to be funny by any means because it's not funny. But at that time, because she actually smelled like she had just had lunch. Not bad, but if you're at one of those very fragrant restaurants that
smell like an onion bowl. Like she just came from an onion bowl. Girl, I'm sorry. I'm sorry. Forgive me. Stop it. Okay. Onion balls are delicious.
No, because you've gone into the Cheesecake Factory and it smells, it's
right.
So she smelled like she came from like the Cheesecake Factory, someplace where she was sitting and eating. And so, stop it. So I thought, because she actually has, and I remember this because she actually, she was snacking on something actually because she was in the waiting room because we were running a little behind. I think at this point we were like 7 to 10 minutes behind. And so she was snacking a little bit. So when she finally came back to the room, I thought she was still chewing, but it was the calculus and everything.
You didn't ask her to remove. Can you rinse out and get the food out your mouth?
No,
Okay,
when she opened, I knew what it was because I've seen like videos and stuff when I was trying to prepare myself to be an assistant. So I knew what it was, and I'm like, because I've never seen it. This is literally
really
right because during the work week was busy. The things that we would see on the weekend we didn't see during the week, and vice versa.
Correct.
So my eyes kind of like got big, and I was like, okay, let me see if and I could not get the we weren't doing sensors because weren't. It was done yet. So I remember one of the doctor owners, he showed me a little technique where people had a difficulty with
Mm-hmm.
biting down or had a small mouth to bend the
Right.
X-ray, and even take it a step further, because even if you try to bend it, it was still kind of like a little sharp.
Mm-hmm.
So he taught me the whole technique with the cotton roll,
Yes.
and putting it
Mm-hmm.
in, and I loved him for that because he was like, no, Gina, let me show you a different way, and so he taught me that technique, and so I was able to get her X-rays, and of course, she didn't need a cleaning. She first needed a full mouth debridement.
Mm-hmm.
But that is a huge misconception that a lot of these patients, you know, think that, the bare minimum is is the only thing that they need because doctors aren't being accountable in what they're diagnosing, so, you know, and I can only imagine the doctors that she was seeing before and if they were under treating her because even though there was a lot of gap in between,
Right.
What
was
she looked like she
before?
never had a cleaning.
And you know how patients are. It may have been 25 years.
That is true.
Because we call it patient years. Because they tell you, I had X-rays last year. You'll say, when was your last full set of images or full mouth series? It's either you stand in the machine goes around your head, or it's about 18 to 20 individual images of your teeth, and they tell you we had it last year, and then you get a copy, and it was 1999.
Girl, yes, and then when you call them on it, it's like, oh,
was it that long ago? I thought it was last year.
Like you knew, girl.
But supervised neglect not only happens with the images, it happens with and I've been in spaces where they have a waiver for periodontal treatment, which is insane. How do you
that can get into the heart and stuff?
How could there was an instance where this person didn't they didn't sign a waiver for refusing perio treatment, but they got treatment and they ended up getting
a heart attack?
Not a heart attack.
Cancer?
Not cancer. Keep going. No, they ended up in the hospital because that bacteria did travel to their heart. Myocarditis, I guess it's called.
Yes.
But that wasn't because of any kind of neglect, but the fact of the matter is, yes, if you leave that active infection in your mouth, yeah, it creates problems because the blood just doesn't flow just in your mouth only. It goes everywhere. And that's another misconception that patients have. Whatever they have in their mouth stays in their mouth. Like your head is just totally disconnected from the rest of your body.
Yeah.
But what happens, and patients don't understand, neither do practices understand, the long-term effects of supervised neglect. One, for the practice, could be you could get sued and then shut down. For the patient is you could get very, very sick from it. So the bottom line is,
another long-term harm is that you signal them when you do this that it's okay.
Right.
And it fosters very bad habits and behaviors to your team, and especially when you finally get to a point where you have had enough and ready to put your foot down. And it's kind of like, well, he's always let me do it. She's always let me do it.
Right. Like the instance with the person in our practice who's always been allowed to skip the images, or was allowed the last 2 times to skip the images. And I will say the doctors are really good about that, and perio treatment as well. If you are refusing the treatment that we are diagnosed, or the treatment that we are presenting to you based off of our diagnosis, you're very more than welcome to go ahead and get a second opinion, but we will not be doing the cleaning that your insurance covers.
Yeah. Because a lot, and the sad thing is that patients are not educated
No.
and don't know that there's different levels to this.
Right.
Because it is.
Right.
So, but, girl, this is the first season down.
What?
First season down. Yes.
Wow.
This was it. You know.
I feel like we should have balloons or something.
When the budget's bigger.
I mean, yeah.
Maybe we can get one of those designer screens. Yeah. We're just, 2 girlfriends getting together, kikiing and chopping it up, just sharing our experiences. And you have any clarity that because I know for me, that even though I keep trying to leave this field, I do know that this field needs me.
Yes, 100%.
And I hope that whatever we're sharing, it doesn't come across as venting to people or bashing to some, because that's definitely not what it is. Again, it is our personal experiences that we have personally endured, things that we've seen and experienced. And no one can tell us what our experiences are because we're the ones who lived it.
Right. And we're just explaining how we navigate through them.
And hopefully you take some things away from that,
hopefully it'll be helpful.
because like I've openly admitted that, I was someone who literally dragged her heels because I was afraid to venture out, and I wasted time, but I'm starting to become a lot more clear on things because there's some key things that I've learned recently that delay when you're trying to do something being delayed is protection.
Absolutely.
That is something that it took me a long time to learn.
Yes.
And that everything has its time and season on when it's supposed to bloom.
Mm-hmm.
And I wish the things that I know now I knew then, but everything has to happen in its own time.
Right.
And especially when you're ready to receive it.
Exactly.
Because there's a lot of things that, you try to tell me professionally that I was still like that little girl inside, and I was not in a mature space to receive it, but I'm a much different woman now.
Yes. Much different now.
What about for you?
For me, it took me a little while to... I'm lying. It didn't take me a while to get my confidence. I think I was born that way. But what it did take me a while to do is learn how to assert myself. In that early in my career, I kept my mouth shut about a lot of things. I would see things and kind of give that.
Like, okay.
Yeah. But then I would quietly move along. But
exit out the back door.
Yes.
Like how some patients do when they're not seen or heard.
Right. I would exit into the bushes like that Peter Griffin meme. But like you said, everything happens in a time that it's supposed to happen. So I'm at this point because I believe that I am able to navigate everything at this point. Now, for instance, could I have been a guest speaker at all these national and international conferences 15 or 20 years ago? Probably, but not as good.
Yeah, because I've seen you work, girl.
So everything happens in the time that it's supposed to happen. And for me, a lot of the things that we have discussed, like I said, I've been very fortunate and worked with very, very supportive, great doctors. And I am thankful for that. And I think a lot of that had to do with me building my confidence, is because they were very supportive of everything that I was doing. I've been chairside. I've been in administration, and as I am now, administration and chairside, an instructor, guest speaker, trainer, consultant, all of it. But it took me a while to get there, only because now is the time. And I'm grateful for that. Word up.
Well, I can't wait till we return back for season 2.
Yes, me too. Maybe all of my hair will be white.
All right, girl. Well, on that note,
yes.
Here's to another season.
Here's to another season.
See you next time.
See you next time.
Yeah. This is tea.